Do you remember COVID? I bet you do. We all experienced many things during the pandemic. We were locked up in our houses, we couldn't go to the schools, universities, or gyms. All we did was explore the internet. Some people claim a disease known as Mpox is going to be the next COVID, while others think this is not true. In this video, we're going to check everything about Mpox, from the symptoms to treatments, and finally, we'll check if Mpox is going to be a pandemic. So stay with us until the end. Mpox, or monkeypox, is an infectious viral disease which is caused by monkeypox virus. This disease was first observed in 1958 in the monkeys which were kept in a laboratory located in Denmark, and the first case in humans was diagnosed in 1970 in the Democratic Republic of the Congo. After that, Mpox spread more in Africa. In 2003, 81 cases reported in the United States of America. Moreover, in 2017, Nigeria reported 172 cases infected by this virus. In 2022, some cases were diagnosed in Britain, Europe, and Australia. In that year, organizations responsible for global health declared an emergency situation because Mpox was spreading rapidly. There are several ways that this disease can spread. The most important one is being in contact with infected people, including skin-to-skin contact. Body fluids are another way of being infected. The second way is being close to infected animals or consuming undercooked meat from infected animals. The virus can also enter through scars, eyes, mouth, or respiratory system. When people are infected by this virus, some symptoms can be observed. Understanding the symptoms of Mpox is crucial for early recognition and treatment. These symptoms typically manifest within 7 to 14 days after exposure to the virus, and the disease progresses through two main phases, the early phase and the rash phase. Early symptoms are non-specific and can resemble those of other viral infections. This phase lasts 1 to 5 days. Let's check some of these symptoms. Fever. The body temperature of infected people rises when the virus enters the body. This is what our body does whenever something strange and non-self is defected by our immune system. Headache. Some people can experience discomfort due to headache, particularly in the front part of the head. Swollen lymph nodes. This symptom may occur in the neck, armpits, or groin. It indicates that the immune system is responsible to the infection. Sore throat. Some individuals may experience a sore throat, which can increase the discomfort. Many people think of other viral diseases after having a sore throat. Fatigue. Like many diseases, a sense of fatigue and lack of energy can be present, making it difficult for individuals to perform routine tasks. Now we can check the rush phase. This phase typically begins 1 to 3 days after the fever and is a key indicator of Mpox. This phase has some distinct stages. Stage 1 is rash development. The rash usually starts on the face and can spread to other parts of the body, including feet and also the palms of the hands. Stage 2, macules. In this stage, the rash appears as flat lesions which are known as macules. These are usually red or brown in color. Stage 3 is papules. The macules will turn to raised bumps when this stage starts. These bumps are called papules. They can become itchy. As a result, people are uncomfortable in this stage. Stage 4 is vesicles. Papules develop, and a fluid fills the inside of those papules. The fluid-filled papules are known as vesicles during this stage. Stage 5, pustules. The vesicles turn into pustules which are filled with pus. This stage can be dangerous for infected people due to the risk of secondary bacterial infections. Stage 6, scabbing. The pustules form scabs, which eventually fall off as the skin heals. This stage can leave scars on the skin. Most of the people will recover easily after the rash phase. However, the disease can be serious in certain groups of people. Young children, pregnant women, and individuals with deficiency in their immune systems are some of them, so they should be very careful. By moving on to the ways of treatment, we can understand the treatment for Mpox. It mostly focuses on supportive care because there is no specific antiviral treatment for this infection. Here are some common and important ways of controlling the symptoms or the disease itself. Number 1, vaccination. There are some available vaccines for Mpox. We can refer to Jynneos, which is also known as Imvamune or Imvanex. This vaccine can be used before and after being in contact with high-risk individuals to prevent infection. Number 2, isolation and infection control. Patients with Mpox have to be isolated. This action is essential as it prevents the spread of the virus to others. Healthcare workers who treat those patients should use personal protective equipment as well. Number 3, management of complications. If Mpox causes the scars to appear on the body, antibiotics may be necessary, as those scars can become infected. But remember, using antibiotics should be monitored by doctors for sure. It is true there is no certain treatment for Mpox, but some medications medications can be effective. Tecovirimat is a medication which has been developed for the treatment of smallpox. It works by inhibiting the protein which is responsible for releasing the virus from infected cells. As a consequence, it limits the spread of the virus in the body. Although this medication has been developed for smallpox, but studies have shown efficiency against Mpox in animal cases. The next medication is cidofovir. It is useful in curing smallpox by preventing DNA synthesis. There is no specific evidence that cidofovir can treat Mpox completely, but in completed cases, it can be considered as a suitable medication. Now, we have a lot of information about Mpox, but here is an important question. Can Mpox be the next COVID? Before answering this question, subscribe to our channel. This shows that you've enjoyed our videos so far. Now, let's answer the question. We have to know some differences between COVID and Mpox to get the answer, so follow us. Number 1 is the mode of transmission. Mpox spreads most of the time through close contact with infected individuals or their body fluids. In contrast, COVID can be transmitted even in the absence of direct contact. This significant difference in transmission mode makes Mpox less likely to spread widely and rapidly. Number 2 is basic reproduction number. The basic reproductive number indicates how many people on average can be infected by a patient. For Mpox, the estimated number is lower than that of COVID. This suggests Mpox is easier to be controlled over populations. Number 3 is existing immunity. Because of the historical use of smallpox vaccines, many individuals have some level of pre-existing immunity to Mpox. The reason is smallpox and monkeypox are from the same family known as orthopox viruses. On the other hand, people had no immunity against COVID, and that led to more cases in a short time. Number 4, geographic distribution. Mpox is endemic to Central and West Africa. Cases outside these regions are also linked to travel or specific reason. This means that Mpox doesn't have the potential to become widespread. However, COVID quickly spread to every country around the world even after isolation. Number 5, environmental factors. Mpox is a zoonotic disease, which means it is transmitted from infected animals to humans. This limits the potential of human-to-human transmission compared to COVID, which can spread between humans rather than animals. While Mpox is a public health concern and must be monitored, it is unlikely to turn into a pandemic like COVID due to mentioned factors. What do you think? Is Mpox going to be widespread like COVID? Share your ideas in the comment section. Like the video as a means of support and share it with your friends. Check out our channel if you want to watch more videos like this. Goodbye.